Welcome to my video where I will be discussing the 2009 H1N1 pandemic and the lessons learned, lessons observed, and lessons lost, and how that relates to the COVID-19 pandemic. We will be discussing three key lessons and examining problems identified in past pandemics and if they were taken into consideration throughout the COVID-19 pandemic or if they were repeated and ignored. H1N1 or swine flu was a type A influenza virus that first affected pigs. It then passed on to humans through contact or contamination, making them ill. Swine flu was declared a pandemic by the World Health Organization from June 2009 to August of 2010 and was first detected in Mexico and the United States and spread rapidly around the world. 80% of deaths from swine flu occurred in those under the age of 65. Vaccination was a lesson learned. With the H1N1 pandemic, Health Canada was able to conduct a prompt review of vaccine safety and implement mass immunization clinics as seen with COVID-19. Vaccination effectively prevented the virus from spreading and mitigated the severity and impact of disease of H1N1, thus a prompt implementation of vaccination with COVID-19. Social distancing measures were also a lesson learned. Social distancing was implemented in schools and workplaces during H1N1 and was highly effective, with some areas of the world implementing school closures and isolations. This was implemented with COVID-19 as it was a highly effective measure for H1N1. Surveillance is also a lesson learned. Contact tracing was conducted with H1N1 for infected travelers on airplanes, and this was adopted amongst the whole population with COVID-19. While some aspects of vaccination were a lesson learned, there are also components that are a lesson observed. For example, vaccine hesitancy and concerns with vaccine safety were observed with both the H1N1 and COVID pandemics, suggesting there is a need for more efficient communication and transparency surrounding vaccine safety and research. Another lesson observed is vaccine shortages. The vaccine supply did not initially meet the demand during the H1N1 pandemic, with individuals waiting in long lines to receive the first dose. However, with later waves, there were large quantities of unused vaccine. We have seen this again with the COVID vaccine supply, thus the need to take this into consideration for future pandemics. Inequities amongst the vulnerable were observed during both the H1N1 and COVID pandemics, as Indigenous peoples, pregnant women, and those with underlying health conditions experienced more severe disease and higher mortality. Public communication is a lesson lost, as with both the H1N1 and COVID pandemic, messaging regarding the virus was inconsistent and confusing as it was constantly changing. There were nursing shortages during the H1N1 pandemic as many part-time nurses worked at multiple institutions and were forced to choose one. This was experienced again throughout the COVID pandemic. PPE is also a lesson lost. There were shortages of surgical masks and N95s during the H1N1 pandemic and again with the COVID pandemic as stockpiled supplies quickly ran out. With better policies and planning, we can overcome these lessons lost in future pandemics.
Created using Powtoon.